Mitzi, take it away.
Great.
And
Thank
where
you.
are you today? Can you let us know?
I'm in Los Angeles today. And I think I don't know where Alice and Ariella are, but I know that we're scattered around. I just want to welcome everyone today. I want to thank Marty as well as Ivy for the opportunity to be with everyone. In the next hour, we're going to actually have a really great opportunity to explore the evolving landscape of venture capital and healthcare through the perspectives of four very accomplished investors who are transforming the industry through their distinctive approaches. You may also note that this panel also stands out not only for the caliber of expertise represented, but also for highlighting a powerful demographic shift in venture capital. Now, women currently comprise only 11% of investing partners in U.S. venture firms, but even that modest number underestimates the impact of women in the funding environment. You're going to see each one of our panelists has broken barriers and achieved significant success, and they can offer their unique insights into both traditional and emerging opportunities in the investment landscape. I'm Dr. Mitzi Krockover, and I'm really pleased to be moderating this discussion. As the founding medical director of the Iris Cantor UCLA Women's Health Center and the former vice president of women's health at Humana, my career has been dedicated to advancing women's healthcare, innovation, and access. And I literally wanted to be invested in it. So I serve as a managing director at Golden Seeds, an angel investment organization of close to 300 members, focused on funding early stage women-led companies across healthcare, life sciences, consumer goods, and enterprise sectors. I also co-lead our health sector group with, of course, my sweet spot being women's health. So today we're going to explore, as Marty said, emerging investment trends and opportunities in the healthcare sector and more, as well as the importance of diverse perspectives and leadership approaches. So without further ado, it is my pleasure to welcome our distinguished panel. And I'd like to begin by having each one of you introduce yourselves, your organization, and the stage of investment you focus on. And I'm going to go ahead and start with those online because I can see you, and then maybe we can tilt the conference center so that I can see our panelists as well. Alice, do you want to take that away?
Sure. Thank you so much for having this panel topic and for including me. Nice to meet everybody. My name is Alice. I'm a partner at Foreground Capital, investing in early stage women's health companies. I've been in the women's health space my whole career wearing different hats. I started out in global public health in East Africa and Asia, working in women's health, then went to medical school and all but became an OBGYN. I ended up, after getting an MBA, going to McKinsey for a number of years where women's health was also a focus. You may have seen McKinsey doing a number of fantastic reports and trackers recently. That was really happy to see that continue there. And for the past almost 4 years, I've been with on the investing side in venture capital. Our fund was previously called RH Capital, now Foreground. We have 45 million in AUM and 22 companies in the portfolio, making us one of the largest dedicated portfolios in this space. And we are mainly investing at the seed to Series A stage, all women's health, but broad across health segments. So that includes the life sciences, digital health services, and consumer health.
Great, thank you. Ariella?
I'm Ariella Golomb. It's nice to be with all of you today. Like Alice, I am also a medical doctor by education and got my MBA, but instead of McKinsey, I went to the Boston Consulting Group. So we have a very similar background. I've been investing for 18 years. In 2017, I started InnovaHealth Partners with 2 other co-founders, and we are dedicated exclusively to medical devices. So we are later stage investors that invest in technologies once they're revenue generating. And we like to take execution risk, not technology risk. We do focus on women's health as one of the subsectors that are a priority to us, but we also are investors in other subsegments within the medical device arena, including neurointervention, neurosurgery, cardiology, urology, and other sectors within healthcare.
Great, thank you. And now I can see our other panelist, Kathy. Welcome.
Thank you. Thank you so much for having me here. My name is Kathy Koo. I'm an investor at a firm called Vive Collective. We are a stage agnostic healthcare only dedicated fund. When we're a relatively newer fund, we started about 3 years ago, completely incubated within Clearlake Capital, which is a general $90 billion AUM private equity group. When we started this about 3 years ago, the idea was that we wanted to be flexible capital for our portfolio companies, starting from Series A all the way up to pre-IPO growth stage investments. And I would say in the past year, for a variety of reasons, both because there's a lot of growth opportunities, et cetera, but we've been focusing mostly on deploying minimum $100 million checks into growth stage businesses. That being said, given our roots in earlier stage investment, our GP and I have made the decision in collaboration with Clearlake that we'll be spinning out of Clearlake this year. And so we are currently in the process of fundraising for a primary/secondary dedicated pool of capital, still focused on healthcare only, but writing more Series A to Series C investment checks into healthcare businesses. My background, similar to a lot of people here, is I come from, I'm a physician by education. I actually dabbled both at McKinsey and BCG, so a little bit of overlap there as well. But I actually started off running 2 of my own businesses in the manufacturing space. So a lot of my focus, even on the healthcare side, covers all of the boring parts of healthcare. So anything that you see on the back end of things that operationalize operations is the majority of where I spend my time in. So thank you so much for having me here.
Great, thank you. And Melanie, welcome.
Thank you, Mitzi, and thanks for being so organized, and thank you all. I am amazed at the youth of these women around me and what they've already accomplished. I'm the bit of an outlier here because I do have a degree in science and a degree in veterinary medicine. I practiced, my patients were all 4-legged pretty much, unless they were snakes. But the wonderful thing about veterinary medicine is you have to be, with all due respect, an expert on so many different systems in so many different species. And what I was able to do with that was practice for 27 years. As physicians, you would know something called hormonally induced asthma, allergy asthma, which I got. So I got to become allergic to everything with hair and fur and anesthetic gas and perfume and smoke and all sorts of things, which derailed my years of full-time practice. So why not? Went into Swiss banking, pivoted from there into investment banking, was able to then pull into my science and medical background, put that together and be the interpreter in the boardroom between medical devices and VCs or investors. Got called to a VC to be a venture partner. Enjoyed that, having been on the buy side, sell side, every side of the street, I guess you'd say. So I'm no longer with that VC. I'm now completely in a completely different world. Pulled in by Jerry Lai, my co-founder, into the world of electrification of parking stalls, and but enjoying it because there's a lot of science involved in that as well. And I'm looking forward to how the rest of these women are going to save the world. I'm just trying to save the climate.
Very well, thank you so much. And so I guess we can all say doctor, 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 and but we won't be that formal. But that's, I guess, another thing that we all have in common. Kathy, I want to start with you. You know, as I noted at the beginning, women remain really grossly underrepresented in venture capital. How has your experience as a woman in the industry shaped your approach to investing in leadership?
Yeah, absolutely. I mean, I think the underrepresentation in women in venture capital goes across both directions, right? You think, I think Forbes released an article that says that women raise generally half as much as women when they start their businesses. In addition, on the venture side, I think healthcare is a little bit better, but across the whole spectrum of venture capital, women deploy about less than 15% of the capital that goes into businesses. And so joining the venture side from the manufacturing side was actually a little bit better, to be fair, but it's still, you're surrounded by mostly men. And it's been interesting as we are currently in the process of spinning out from Clearlake, the number of people who have with great intentions have commented, have you considered hiring a guy to help you in the fundraising process. And the number of times I've had that conversation makes me take a step back and think about what that means for us as from the fundraising process, but also as a community. And throughout, various experiences, and I'm sure everyone on this panel has had, similar experiences. I think I'm also much more careful about checking my biases at the door too. When I'm talking to founders, I think women founders generally feel very surprised and welcomed by the fact that they're talking to a female investor, especially on the growth side, because there aren't very many on the growth side either. And it's just been an illuminating experience sitting on both sides of the funding and the fundraising side now to kind of be a little bit more empathetic to the process in both directions. And I think it's also made me a little bit more aware of how I approach individuals who might not see the gaps there either. And I don't know, I'm having a little bit of trouble. I thought about this before, and I have a lot of difficulty articulating the experience and how it has made me a different investor, because I have only been female in my shoes, but it's definitely, I think we are a little bit more open, and we try to be more aggressive in how we open up opportunities for women in the space.
Great, thank you. I think you're very articulate. Does anyone else want to add to that? Okay. Each of you, well, go ahead and go on. Each of you has had a unique focus in your individual investment strategies. So let's talk a little bit about this. Melanie, as you talked about, you wear an additional hat from the other panelists. As an investment banker, you're focused on health and science, and as an entrepreneur, you're in the EV space. How are you navigating the balance in wearing both hats between rapid technological advancement and sustainable business growth?
Let me preface that by saying I'm so happy that men are now allowed to show that they're fathers in business, because there's one other hat that many of us wear, which is as a mother. And when I think of the number of times I used to hide my kids under the desk or behind the door, give them a quarter if they didn't talk, if I was on a cell phone or a Skype call, craziness. So it's quite fun wearing all these hats. But the hard part when you work with when you are founding a company and you're running, it is all about sales. It is all about orders. It is all about, think about it. We started just a year and a half ago. How would you have started? You have to get sales in the door. You got to figure out where is the lowest hanging fruit. So I put my investment banking hat on and thought, oh, wait a second. I know the major developers in Vancouver. I'll go to them. They knew me. We told them about our company. We told them that municipal codes are such that you have to electrify so many stalls in these new buildings, and then you have retrofits where stratas are demanding parking stalls as well. They got it, and we waited till the penny dropped when they came to us and said, actually, could we invest in your company? It was sort of the perfect scenario. So you're constantly thinking about orders. To a degree, you're thinking about your round, but you're also thinking about anything else you should be doing to to push the company forward. There are a lot of competing interests in your head, and still those kids are in the background, even though they're fully grown and they want things as well. So I think it is a little bit of a, listen, the thought anatomically is the reason why women, in case you don't know this, are formed physically the way we are. The reason we have a waist that goes in is the fact that you're holding a baby while you're stirring a pot of chili, right? Or whatever it was you're making back in that's the evolution. And so now tie that into, and you're taking a cell phone call, and you're trying to make sure your startup doesn't crater. Women are incredibly capable. Women are incredibly strong, and it's time to pay attention. They're your sisters, they're your mothers, they're your daughters. There's people like us. Invest in us.
Great segue to Alice. Thank you. Yes, invest in us and invest in our health, right? This year, JPM had an amazing number of events and panels on women's health. I have so much FOMO for not being there. Probably more this year than any other year, as well as companies seeking investment funding. And, Alice, you and your colleagues at Foreground, previously RH Ventures, were some of the earliest investors focused on funding women's health companies. So for those who are new to maybe the whole women's health sector, you talked a little bit about the kinds of companies you invest in. Talk a little bit more specifically and why this is such an important sector and how you see it growing in the coming years. Is this a fluke?
Sure, yeah, happy to address this. And as noted earlier, I spent my whole career in women's health with different hats. So I've been watching very keenly from different perspectives, and we are definitely in a different time now than even 3 to 5 years ago. So perhaps we start with, what is women's health? Well, women's health, there's really a few different areas. One is the part of women's health that is specific only to women. So this includes reproductive health, such as fertility, maternal health, PCOS, and other gynecological conditions, and more. But women's health is actually broader than that. Women are also affected by conditions that affect women differently. For example, cardiovascular health. Women have different types of heart attack than men do. And then there's another part, the last one, which is areas that affect women disproportionately, such as autoimmune conditions, Alzheimer's disease. These are migraine, for example. These all have predominantly female populations. That's why women's health. And let's talk about, let's talk about the why. So why does women's health matter? And I could go on and on for all of the reasons around gender equity, healthier societies, healthier families that women care for, the young and the elderly, and just the fact that women's health has been historically neglected in modern medicine. But really, what I like to talk about even more is actually why I think women's health should be mainstream, which is the business case. So in very few other places, you have A, large populations, with B, significant unmet medical needs, and C, virtually no competition. So, how many times have we looked at a new oncology drug for a specific type of cancer that is coming in third line? Well, in women's health, for many conditions, they are underdiagnosed and undertreated, so there's really no standard of care today. But then the next part I would get to is then the why now. If it's so historically neglected, is there anything to invest in? And the answer is actually yes. So we are at a very exciting time in this trajectory of women's health growing, where there is rising innovations, more and more companies that are being formed, rising number of funds that are caring about the space, not just specialized funds like ourselves, but generalists that are coming in, as well as public awareness, even policy change. I've had the pleasure of meeting Dr. Jill Biden a few times over the past year, and what that administration has really done to put women's health on the map is quite incredible. And there's no arguing that there are many bipartisan women's health issues that will continue to receive attention.
Terrific. You talked about kind of this, the environment, and I would add to that the number of women in not only venture capital, but as entrepreneurs, as scientists, as clinicians, and even policy makers. And we know that, for example, women scientists are more likely to focus on women's health issues. Yet on the other hand, you've got these female entrepreneurs who are, for the most part, they're the ones that, for the most part, are the women's health entrepreneurs, going to the other 90% of venture capital, if you will, and trying to explain the need and the opportunity for their product, service, or device diagnostic. What would you say to the audience now who may be thinking about that, no matter what their gender is, if you will?
Yeah. Is your question, can men innovate in women's health? Can men invest in women's health? Is that the question?
All the above, but I think mostly the investment piece, because I think, again, we've seen that interestingly, male entrepreneurs in the women's health space seem to be more successful than the women entrepreneurs in terms of funding or fundraising.
Got it. Yep. Yeah, if we take a big step back, you've highlighted earlier that the majority of decision makers in venture capital are men. And actually, you didn't highlight this one, but it's also true that the majority of entrepreneurs are also men. And in fact, PitchBook has some really interesting data looking at female and male co-founded teams versus just one or the other. And there's very little funding going to all female founders. That's the backdrop of the reality that we live in terms of innovation and investing. And in women's health, we actually do often have more female entrepreneurs who are driven sometimes by their own experience. Their health issue has not been solved by incumbents, and that inspires them to go solve it. And unsurprisingly, many of the early investors in women's health often are also women who somehow, the issue at hand does resonate more personally. But if you take a step back, though, I just highlighted the business case for women's health, right? Big populations, new innovations, disruption. Well, I actually don't think that only women can invest in women's health, or should, and found companies, because if there is a large opportunity, then that actually should make everyone interested. So for example, it's not just people with diabetes investing in diabetes companies or starting them, and same with oncology. So my hope is that while many of the early, founders and investors certainly are personally, passionate believers, this is really moving towards a mainstream opportunity. And I do have many, male investors that are, we talk to regularly in the space, who see the opportunity, and that's a great reason to celebrate.
Thank you. And Ariella, just moving on to you, you're someone who invests in medtech. What's been your experience in the women's health sector, and what are some of the aspects that differ and are the same with respect to investing in this sector? And if you want to add on to anything that Alice said, love to have you comment.
Thank you. Well, I agree with everything Alice said. I think that
That was easy.
yeah, she did a very good job of laying out the landscape and the opportunity. The only thing I would add to that really is that the acquire universe is maturing, which I think is a really nice opportunity. So we're seeing some really nice exits that help us in terms of making the business case and justifying the spend. So you had the Gynesonics acquisition by Hologic and Organon buying Lydia, and there are some really nice deals happening of substantive size, which is what we need to help develop the ecosystem and to help get more earlier stage companies funded. So that's a really important piece of the story that's happening. But when we look at the other subsectors of medical devices, there's some challenges that are also unique to women's health that need to be navigated. And one of them is the political overlay. The fact that when you look at IVF and you look at contraception, there's a layer that we don't need to navigate in other areas. So that's an important consideration when we're looking at the funding and understanding which are the investments that can get, that aren't going to be exposed to those type of risks. And then we do want to invest in contraceptive options and IVF, and how do we mitigate the political overlay? So that's something we're not seeing as much in other areas, and we don't see that in men's health, and that's something to navigate. And the other thing that I think is making it easier to invest in women's health is the destigmatization of just having these conversations. And I think that with TikTok and Instagram and social media, the newer generations are more comfortable talking about conditions, and there are younger investors who are more capable of having conversations in a more removed way, so that these technologies can make their way to the boardrooms and have conversations and talk about parts of the anatomy that aren't normally talked about around the table. And that needs to happen, and people need to get comfortable from all ages and all gender identities to be able to have these conversations. And that's getting easier, but there's still a lot of work that needs to happen in that regard as well.
Right, thank you. And Kathy, healthcare in general, healthcare investing, I should say, requires really deep domain expertise. How do you evaluate opportunities at the intersection of healthcare and technology? And what role do you see for family offices in this space?
Yeah, great question. I'll start off by saying I think healthcare investing is really hard. And despite having a medical degree, I think it just gets my foot in the door and having a gut sense of what makes sense and what doesn't make sense.
Can you move closer to your microphone?
For example, I think, gut intuition might be in the peak of COVID, physicians are quitting, nurses are quitting, and somebody says, okay, I'm going to start a startup that trains resiliency in physicians and nurses. And everyone's like, great, maybe that'll help with the retention issue. And my reaction is a visceral one. And I'm thinking, you want to tell my husband who's working 100 hours a week that he should do resiliency training because that's the issue right now. So I think, the MD only helps so far in terms of getting that gut reaction, but the intersection of healthcare and technology is so much more, because in healthcare, there's so many perverse incentives, oftentimes of service provider, as well as it's no longer a relationship just between the service provider and the person receiving the care. There are so many intermediaries that are getting paid along the way. And frankly, not everyone has it in their best interest to increase the efficiency of a healthcare system. And I think this is where we try to, as healthcare investors, try to tease out beyond having just a good product, who is actually interested in paying for this? And because oftentimes I feel like there's a ton of waste in healthcare where so many entrepreneurs are creating these great products and they're never used because people, you are talking to the wrong buyer, the wrong person who wants to actually pay for it. And within our firm, we have a network of 2,000 folks across health systems, payers, and pharma, because at the end of the day, those three entities are the folks who are oftentimes paying the most amount of money across this industry. And so we call those folks up and ask, what do you think about this product? Do you actually want to pay for it? And we try to make connections to those who are interested, as well as and the founders who are building in that space. And I think that's where investors can actually truly bring value at the intersection of healthcare and technology, where you help the technologists understand healthcare, and the folks paying for that healthcare kind of connect with the technologists. And sometimes it requires a ton of patient capital, and this is where family offices come in, whether you are a purely financial investor or you have a triple bottom line, or there's some relation to the healthcare system where a family office, for whatever reason, wants to dip their toes into this very complicated ecosystem. Family offices can be one very patient capital that is thematic and continues to drive change even where change is slow. And second, if the family office happens to have connections in the healthcare industry, I actually think this is where you can help push that change, because healthcare, for better or for worse, oftentimes who actually does go a long way. Folks in pharma jump from one institution to another all the time, and their decision-making process can sometimes just be as simple as, well, I've used this software before, I know the software, and so I'll continue to use the software. And having those connections can go a really long way, which is why we devote so much of our time building those networks as well. I'll kind of share a funny anecdote as kind of like the last part to this. So clinical trials, I've always wondered why health insurance companies aren't more involved in clinical trials, because once the patient is on a clinical trial, pharma pays for that drug, and that care is provided and paid for by pharma as opposed to the health insurance company. And so I was talking to a few friends in health insurance companies. I was like, why don't you guys try to get your members more involved in clinical trials? And they're like, whoa, this is a touchy subject, because they can't, few of them, I won't say all, a few of them can't wrap their head around this idea that if they help push a clinical trial, then if the drug gets approved in the long run, they're like, well, this is going to be more costly to us. But I'm like, hey, the clinical trial is probably going to get finished whether or not you were involved in it. I mean, it may take a little bit longer time, but at the end of the day, if the drug is good, hopefully it gets approved for the greater good of healthcare. But there's always these little bits of stickiness that prevent that change from happening. And I think, whether it's patient capital through venture capitalists or family offices who are involved in this process, that constant communication and keeping it on the radar can go a really long way.
I have actually a couple of questions I wanted to just ask. So I know that several of you are doctors. My partner's a doctor, and I know that people here in the audience have daughters. I have 2 daughters, and I'm just wondering, do you guys ever consider, whether it needs to be a paradigm shift or the Overton window has to change? I mean, we just spent 2 years discussing, transgenders in women's sports, for example, rather than women's health, right? And I'm just wondering, how do you get to that Overton window shift where women's health on a daily, I mean, to me, there's tremendous issues of women's health, just starting with stress, right? You have so many women who are parents and the only caretakers of their parents, right? I have a friend right now who is flying back and forth to Korea. She's a single mother in New York City to take care of her two ailing parents in Korea, right? And I think that this is not uncommon. And I mean, I know that everybody's like has accolades for women and their ability to handle stress. Doesn't mean it's right, right? So do any of you people have any perspective on that and what it's going to take to shift the Overton window so that just everyday issues of women's health are discussed on a realistic, just plain spoken basis? And Mitzi, maybe you can address that first, and you know who to follow up with on that.
Yeah, sure. I'm not sure I understand the question specifically, but I will say that, and I think Alice and Ariella talked a little bit about this as well, and that is that there is more conversations happening. And again, we're in this kind of ecosystem, so we're a little bit of an ecosystem as well. But it is happening, and at the same time, I mean, part of the challenge for women's health is that research did not include women for a very long time because of kind of wanting to protect unborn babies and the hormones, and made it more challenging. And it wasn't until about 30 years ago that women were mandated to be in, and other underrepresented groups in clinical trials for NIH funding. And so a lot of what we know now is new information that hasn't really gotten translated even to the physicians yet. So as Alice said, and this is why I got into investing, is that women were coming to me that were starting their own companies that because they couldn't find the answers to their healthcare problems, either in the marketplace or on the shelf. I'm sorry, or in the healthcare system. And I literally wanted to help. And what's really been exciting about this whole quote femtech or women's health entrepreneurship, if you will, is that these women and some men are coming up with the answers, and the female and male scientists are starting to focus on discovery in this area. And what's also very exciting is that a lot of the companies are generating data, real world evidence that we haven't had before. And so, melding that with the clinical trials and so forth is, I think, very powerful, but we're just at the beginning. And as Alice said, there's a lot of white space there. So there's a lot of opportunity. So, and again, as Ariella said,
So I'll restate that as research dollars follows public focus. And how do you get the discussion from public focus? I know you guys are very, deep down in the weeds in terms of specific projects, et cetera, but how do you change public focus so it's a matter of fact that women's health? I mean,
Sure.
my partner was a regular doctor seeing 30 patients a day. She became a doctor, a concierge doctor, where she sees 3 patients a day. I mean, what a difference in stress level, right? I'm just talking about, how do you change the Overton window, the point of discussion, so that it's matter of fact that it's important and that more research dollars need to be allocated? How does that change?
I'll say real quick, and then I want to open it to the, it is advocacy and policy, and that there is now a policy movement. Again, Alice talked about the White House research initiative in women's health that really did bring women's health to light in a different way. We have policymakers that are focusing on maternal mortality. And so there is kind of this, again, movement, if you will, that is happening. And I think also to the point that there's a lot of men, as you are, that understand that, people in their lives, this will benefit them as well. I'm gonna stop talking because I too could go on and on. Who wants to
I'm happy to talk
add to
about an
that?
example
Thanks,
of,
Ariella. Sure.
one of our investments and how it kind of had a broader effect in changing the mindset. So one of our portfolio companies, a company called Materna Medical, and they have a solution which allows women to protect their pelvic floor during childbirth. So for the first time, women don't have to have a destroyed pelvic floor while they're having a baby naturally. And so it's a very simple concept. It's a totally new way of thinking about it. But we have clinical data that shows that 11% of the time when women have babies without the device, their muscles are torn off the bone in their pelvic floor, and they're leaving having a baby with a tremendous risk of having pelvic organ prolapse, incontinence, and really, really bad outcomes later in life. That's 11% of the time there's a total tear, not to mention the partial tears. With the device, we're seeing 0 tears. And talking to doctors and patients and them understanding that just because I'm having a baby doesn't mean that I have to have these problems later in life is a totally new way of thinking about it. And they haven't even been able to say there's actually something wrong with it when there's no solutions. So we're actually now looking at reimbursement for the device and seeing that the DRG for childbirth is the lowest paid of all the DRGs. And so there's something wrong with that, and that needs to be fixed. And if you're not paying for childbirth, you're not going to get good, the hospitals don't want to have loss leaders. You're not going to get good childcare, and these moms are not being taken care of well. So saying that we're going to challenge how women are going to be treated and that there are new opportunities to help them think about what they're facing in life differently allows them to start rethinking other things they're experiencing that too. And I see that also with menopause, right? So there's this huge movement right now of people saying, I don't really know what's going on. No one told me, there are no resources. Let's talk about this. And there's a huge wave of people being like, we really don't know anything about it. So by investing and offering solutions, it's kind of opening up the fact that there's so much we don't really know, and maybe we can actually think about new ways to fix things.
Great, thank you. Alice.
Jump in and say, I absolutely agree that a paradigm shift is needed, and that's across many different areas. One is medical education. That's very much lacking in terms of many women's health areas, and even just thinking of women differently and not just small men. Also the policy level, the public awareness level, and I do think there are signs of change across all of those. Ariella mentioned menopause. For the first time 2 years ago, there was a menopause ad in the Super Bowl. That could not have been imagined, even a year before that could even be possible. So the continued conversations, destigmatization, I think will play a big role. And yes, indeed, all of us are very deep in the venture capital space. So, with any big change, there's the questions of where do we start and what tool do we have? And we are all using the tool of venture capital. So that's, kind of company by company, patient by patient.
Great, thank you. And I can't see the gentleman who asked the question, but thank you so much for that question.
That would be Morty.
Hi. Oh, thanks. Okay. Sorry about that.
Melanie, you had a response?
Yeah, I just wanted to I wanted to thank Marty, because I think the way that we bring this into focus is through men. I think this is a he to she moment. I have gone through menopause, not fun when you don't know what's happening to your body and it's burning up. There are lots of things that aren't fun that women have just put up with for years. The idea that it's losing pelvic floor muscles is as high as 11% in childbirth just floors me. That's just unbelievable. When I think of family members that have been rushed to the emergency room with acute pain because of endometrial attacks, because of, polycystic ovarian attacks, all sorts of issues. I'm not joking when I say you would get more relief. A cow would get more relief from a follicle that was overgrown on a ovary than a woman would in an ER. The woman is turned away, said it's all in her mind until that follicle explodes. These are very, very real things. I think it's a female issue in that we have been by nature taught to wear pink and braids and be good little girls and not complain. That's just institutionalized the way we are. You talk to your wives, right? You talk to your grandmothers, your mothers. That's how we were raised. We weren't raised to be assertive. Maybe this next generation is, and I hope so. So we have to get the help of people like Marty, who's got a female partner and a doctor, who's got daughters, who gives a damn. That's, I believe, where it starts. And that's what I'm going to do with my voice, is appeal to the men to help lift us.
Thank you. Kathy, did you want to weigh in as well?
I think everything, I don't think I have much to add. Everything has been said well, so.
Sorry,
No.
I get a bit impassioned sometimes.
No, that's terrific. Well, let's shift a little bit and drill down to some more specifics with respect to evaluation of companies from your perspectives. And so, Melanie, I'll start with you. Can you share a specific investment where your unique perspective, and I think we just heard some of it as well, led you to see the value that others missed? And what were some of those key indicators that gave you that conviction?
There's one company that comes to mind. It was a kinase company when actually I was, if I can speak about that, when I was doing capital raising for them. It's actually how I met my partner, Jerry. He was on the other side. He'd raised as many millions as I had, and he was my competitor. We ended up becoming longtime friends and now partners. And this company was, you've probably seen this with family offices. It was classic, where you had a bunch of scientists, really smart scientists. They had, there was the genomic code, right? Which people broke a lot faster than they thought they would. Then there's a genomic code, which are the kinases. Kinases, anything with the word ACE means it's an enzyme made of proteins, and it means it has an action. And kinases are basically these kinetic enzymes. Anyway, doesn't matter, except that very important that they had two parts of their company. One was what I would call like reagents, assays, kind of like selling salt and sugar and pepper from the pantry, kind of staples for any biomedical lab. So to me, the kind of investor there would be, sorry for the jargon, but like what we call the widows and orphans. It's very safe, solid, not going to have a huge return, but you're going to do fine. They have another end of the business, which was research and development. And this was breaking, like this was amazing research they were doing. And I came to them and I said, you should not be one company. You should be two companies. You're going to capitalize way more because you need different kinds of investors for both companies, for one thing. Unfortunately, the CEO died. This isn't the first time that ever happened to me on a deal. So then there was this great institutional lack of management, and no one can make a decision. And I actually had a company that wanted to acquire them, and they didn't pay attention to it. That company did exactly split into two. They'd done the same thing, and they made so much money with both companies. This company finally, and maybe it's because it's Canadian as well, and we tend to be slower off the mark perhaps, but it finally did break into three companies, and one of those companies just went, did it go public or did it get acquired? It got acquired, yeah. So that was frustrating in that moment, because that's going back now 13 years, I think, and we could see the writing on the wall, and the own company couldn't see it. I don't know if that answers your question.
Oh, sure. Absolutely. It's all about the founders, right? So, Alice, when you're evaluating founding teams, again, we look at founders and team, their skills, their history, whether or not they've achieved milestones or traction or differentiation. But what non-obvious qualities do you look for, and what red flags might steer you away from an otherwise promising opportunity?
Sure. And I'll just say, when I first transitioned from consulting to investing, I thought, great, I'm going to apply all my consulting skills and diligence, the market, the product, the science, the reimbursement, and the people, that's the hardest part to diligence, and it's really make or break. It makes such a huge impact. You can have the best product, but if the team isn't right, and I don't even mean skills, I mean soft things that you are actually really hard to diligence, it really makes a huge difference. So the non-obvious things, I would say perhaps two qualities. One is how collaborative is this founder/founding team? Are they open to feedback? Are they curious when they are thinking about their product, pitch deck, anything, and which is a signal for how it will be like to work together. And the other is around trust, particularly between co-founders. It's co-founder dynamics are really tricky. How they work together, how they are mutually incentivized, whether cash or equity. There's a lot of really complicated dynamics, and those are just really important things that we do look out for while we are getting to know teams.
Great, thank you. Kathy, at Golden Seeds, we try to follow our entrepreneurs as they progress. And more recently, we actually put some structure to that to make sure no one really falls through the cracks and make sure that we provide any support they might need. How do you at Vive support portfolio companies post-investment? And what strategies have been most effective for you all?
Yeah, absolutely. I think I touched on this a little bit earlier, but I would consider ourselves to be a little bit more hands-on, even at the later stages, and that truly depends on what the business needs, and the value that we bring as being healthcare-focused investors is the network that we bring to them. And we've in the ZIRP era of 2021, we saw a lot of generalists coming into healthcare, and that did great things or wild things for founder valuations and things like that. And we're seeing on the growth side nowadays a lot of founders who raise a ton of capital. They still have money on their in their books, but their cap table is a little bit lopsided, and they feel like their investors aren't bringing value to them at this point. And so this is where we start having conversations as healthcare investors, trying to bring back healthcare founders into the healthcare investor ecosystem, to be honest, and say, hey, we can we understand the process. We understand that healthcare sales cycles tend to be a little bit longer. There's a lot of again competing interest. There's a lot of red tape to go through, and I think just being the empathetic board member on that cap table can go a long way. And for the founders, we go in at post product market fit, post initial contracting stage. But for those who have that product market fit and are just looking to kind of hockey stick into accelerated sales, I think we can bring in a lot of those as well. So it's a lot of it sounds, we're not doing anything special. Let's be perfectly clear, but it is very much being responsive to founders and where they need support through our network.
I think that is important. And when it doesn't get done, you lose touch. So I think it's so important. Yeah. Ariella, talk about your due diligence process as a private equity firm. And, if you were talking to VCs, how should they listen to this and review companies as they look at potential exits?
Sure. So we're later stage and we make big bets on companies. So we almost view our due diligence process as the same process as strategic would go through to acquire the company. And we go really deep. And it's really important because we know there's two buckets, the stuff we can fix and the stuff we can't fix, right? So we know we're not going to find a perfect company. There's no company out there that's perfect. There's always going to be problems in diligence. But the real key is figuring out what you can fix and what you can't fix and what that involves. And the stuff that usually falls in the bucket of what you cannot fix is usually IP and usually reimbursement strategy, right? So if there's no reimbursement path, it's really hard to create one when it doesn't exist. So those are usually, when you see why a deal doesn't happen, those are the things that are usually deal breakers. The bucket of things that we can fix are operational, people, needing to bring team in. I agree with Alice, like the hardest part is getting the right people. You can have the perfect technology, but if you don't have the right team, your company's going nowhere. Distribution agreements, cleaning up legal documents, and and also regulatory. A lot of the times the regulatory work needs to be done, and it's just a lot of hard work and knowing the right network to bring in. So we invest a lot of time, and I think the most important part of our diligence isn't the black or white, should we do the investment or not? It's actually the strategy that gets developed as part of that process, because the CEO and the leader that we're partnering with, doesn't have the funds and doesn't have the time and the energy to take this moment to really assess where the company is. And a lot of times they're very receptive to the amount of money we're spending on the market research and the conversations and the evaluation. So coming out of the diligence, it's not just the confidence that we're making the right investment, but it's the what is our plan on day one, and how are we going to partner with those executives, and having the team we're going to work with buy into the day one plan. So that's the really generative part of the diligence process.
Great, thank you. Well, we're going to shift a little bit if there's not another. If there are any questions, please let me know. We're going to take a look in your crystal balls, and love to have you share your insights about what key trends or innovations that you're currently excited about in your respective areas. And are there any emerging markets or technologies that you think are currently undervalued or overlooked by traditional venture capital? And I'll start with Melanie and ask each one of you.
I was just writing notes.
Oh, surprise.
So I have this belief that, like they say, you are what you eat, you are what you invest. So, where you're going to be on that fateful day or night when you're lying on your deathbed. I use this all the time. What did you stand for? What did you do? Are your kids going to be proud of the legacy you left? And then work backward from there. So for me, why electrification of parking stalls, with Aether EV, kind of a, contortuous place to end up when you start off in science and medicine. I have a very curious mind. They just took me there. That's okay. Because for me, it's about, stopping 1.2 million tons of CO2 with every electric charger, stopping the greenhouse gases. That's important to me. Saying to my kids, I did that. I tried. And there are so many different areas to be looking at now, whether it's electrical grid changes, whether it's wastewater treatment, whether it's renewable energy. There's many, many different things you can sink your teeth into and feel good doing it. So just consider you are, what you invest in.
Great, thank you. Kathy, I'll come over to you.
I'm excited about, from the growth side, I'm a little bit excited for reprieve from this market. We haven't seen too many healthcare exits recently, and I think this will change. That being said, having straddled both private equity and venture capital for the past few years, I think we'll see more consolidations. We in healthcare, there aren't too many strategic buyers, and so what ends up happening, or I think what will have to happen, is that you have a ton of point solutions supported by the funding of AI solutions today, and those companies, might execute very well. They might be great products, but at the end of the day, in the healthcare grand scheme of healthcare, they're just a point solution. And what I'm excited about is the ability to bring them all together to create a platform solution and get them to a scale where it makes sense for a meaningful exit. And I think the time is in this next upcoming cycle. We've seen a lot of in 2021, we saw a lot of companies potentially overfunded and build great products and assets. And in the coming years, supported by AI, we'll hopefully see some of those, gross margins go up, and hopefully there's enough of a big market to kind of roll them up.
Do you think that will enable or make it easier for some of those reimbursement challenges to be solved?
Ooh. Well, come January 20th, I'm not sure I can answer that question. I feel like I would need like a crystal ball to truly predict what will happen. So hard to say.
That's fair.
I have a comment there, which is according to RFK Jr.'s diary, women are well represented. But so my question is, we talked about exits, but what about off takers, right? So obviously, it's always better when you have a deal where somebody's going to buy all your product, right? When you guys look at the deals that you're looking at, are you looking at, who are the off takers and how are you going to get it, distributed, et cetera? Can you talk a little bit about that?
Ariella, you want to take that one?
Sorry, can you repeat the question? I got tripped up by the
I
RFQ.
make a lot. So I had somebody come to me and they were like, well, I'm right now I'm distributing it into the, Dallas healthcare system or Northwell or something like that. I mean,
Yeah,
obviously, there's if you're talking about natal care, there's a lot of, natal areas and hospitals, prenatal care, et cetera.
right.
And so like, how does that figure into your calculus? And
You're talking about distributors
I
and sales infrastructure, and how do we address that? Is that the question?
no, I'm talking about, well, so distributors and sales infrastructure are part of the ecosystem, but who's the end buyer, right? So
Oh, you mean
I know that Kathy was
you're
talking about
the
insurance
strategic.
codes.
Are you talking about the strategic exit for our investments? That's the question?
No, not the exit at all. The purchaser of the product.
Oh, the decision maker for the purchase. Sorry.
Right. I mean,
Device
how you
exit.
get how you make that happen.
How it
right?
happens. Yes. No,
Because
it's very important.
we've
Right.
seen that. Like I had a woman who was she was like a natal cardiac specialist, and she had developed a device because a lot of children who had cardiac problems were getting infections. So she had developed a device to prevent that, like, while they were in the hospital, right?
Right.
And we went through a whole discussion about who were the buyers of the
The
product, et
decision
cetera, et
maker.
cetera.
Right.
Yeah,
So
right.
you have to get access, right? So that's an important part of the diligence, to understand the sales cycle and how you have to, what are the committees you have to go through, and what is the economic analysis you have to have. And you could have a product that there's a clear clinical benefit, but there's no budget to purchase capital equipment. So it's never going to get in the hospital. So you have to get on the capital equipment purchase cycle. So you have to understand, how is it going to get paid for? Who makes the decision, what data you need to show to them. And it's not just data for FDA, right? So it's data for reimbursement to always be worried about. And then how do you fit into their capital decision-making and priorities? And then also a really important question, who are the physician advocates? Who are your key opinion leaders? But also a lot of times with the devices, it's the nurses, right? So you have to get the caregivers, and sometimes it's the physical therapists. And so who's responsible for the medical outcome, and how much power do they have to make a decision? So it's multifactorial, but that's a very important part of the strategy.
So as advice to the group here who may invest directly in women's health products, what's a good turnaround on that purchasing decision, and what's a bad one that would lead you not to invest?
So we won't invest unless we have confidence that the data and the product and the positioning will get sold. And that's why we wait.
Is that a 2-year cycle, a 10-year cycle, a 1-year cycle?
So it depends on the capital equipment in the hospital, right? So sometimes you're in and then you don't have to go back, but sometimes you have to, always reevaluate. For us,
my question is, what's your expectation when you make a typical deal?
Sorry. So we have a 4 years is ours.
4 years, got it. Okay,
Yeah.
and everybody else about the same, or
Is that after
more or less?
FDA approval?
Yeah, so our investments have all our companies we invest in have a revenue generating component. We'll fund clinical trials for future innovation, but our average weighted life is 4 years.
Ours is longer because we are investing mostly at the seed stage. And we have a 4 to 5 year investing period, and then it's a 10-year fund life cycle.
I have met some really brilliant women entrepreneurs in the healthcare space, and I think one thing that they always discount is the kind of staff you need to get to sell into the healthcare systems, right? You really need somebody who's really smart and perspicacious and has connections already, and won't stop. And it's tough to get those people in mass to convince the hospital systems to buy your product, because let's face it, I mean, so many people already work for the majors, right? So it's hard to get them to hire them away, et cetera.
Well, this comes down to Alice's point. That comes down to Alice's point about it all coming down to people at the end of the day.
Well,
We have a couple of minutes. Any questions from the audience? Okay, yeah, sure.
Is there another question?
Yes, here comes. tracking down a mic. So I'm Jason Barber. I'm with Syncrino Development Company. We're therapeutic. We invest and develop in individual therapeutics programs. This is actually a question for Alice or really anyone else here who is therapeutically focused. When you think about therapeutic areas for the next 5 to 10 years, where there's the potential for both clinical and commercial impact based on the current ecosystem, where do you look? You threw out a few before. We talked about everything from heart disease to autoimmune disease like lupus. What is your take on the major therapeutic areas where there's opportunity?
Yeah, well, so we're a little biased. We only look in women's health, but within that, there's a lot of opportunity.
Well, that's what I mean. I mean specifically within women's health, to be clear. Sorry.
Yeah, a number of areas. I mean, there are some conditions that need to be treated, surgically or with like a device, but there are many that can be pharmacologically treated. So areas like endometriosis, there's great need for something disease modifying that's non-hormonal as one example. And contraception, honestly, there's a lot of options, but they're all hormonal really. So there actually is room for disruption there as well for something non-hormonal. There's a number of others as well within maternal health, for example, preeclampsia, preterm birth. We don't have therapeutic options for many of these areas.
Right.
I would also add lung cancer in women and osteoporosis. The current medications that are there have side effects as well as can, generate other fractures. And so we really don't have a good therapeutic for that as well.
What about lupus, early onset lupus?
Autoimmune.
Yep. Yeah. Agree there as well. I think that the challenge is where do we understand enough of the underlying biology to be able to develop innovations?
Fair enough. And then could I ask one more follow-up, Marty, if that's all right? And this is actually for Ariella. I'm really intrigued by the pelvic floor protection device. Can you say a little bit more about the company and the device?
Sure. So we're actually raising a round, and I just put my email in the chat. So if you want to talk more about it, it's a company called Materna Medical. We have incredible data, as I mentioned, that will allow us to get the CE mark in Europe, and we have another product that's already commercialized. So the company has revenues as we're going to FDA on this current labor and delivery product. But we had a great JP Morgan and just talked to all of the strategics that want to be in the labor and delivery call point. I will say that labor and delivery is increasingly getting attention from the strategic as an area to focus on. And I'd be happy to introduce you to the CEO if you'd like to find out more.
Yeah, that'd be great. Thank you, Ariella.
Hey, yeah, I just had a quick question just in regards to investments. I have an aunt that's had lupus since she was young, so and other women as well. Are you guys strategically looking at, and especially in the healthcare space, at other investments with alternative medicines that may be on trials, or how do you guys look about that and different CEOs and women's in health with the alternative medicines at all?
Happy.
I can take that. And I'll just say that I think it's a shame that there isn't more, but I think you'll see a lot of traditional investors in healthcare shy away from alternative therapeutics because of their LP base as well. And so we do not look at anything that remotely starts going into, I don't even know what to call the category, but I think it's a shame. I don't know if you guys have better luck looking at alternative medicine.
Yeah. We typically have a bias towards products that can be reimbursed and prescribed because we are thinking about access for the patient. So we tend to prefer reimbursed things and then also look for strong evidence base, which is required if you go through the regulatory process. So we don't actually spend a lot of time in supplements or other kind of over-the-counter products because we look for those two things, but not to say that that doesn't play a role in the health system. And there are certainly many investors that are more consumer health leaning that would look at that.
There are a couple of companies, however, that look to manage certain diseases and autoimmune. There are at least 2 companies that connect with specialists, but also do more of a holistic looking at diet and other lifestyle kinds of things. And so there are those companies that are focusing on autoimmune disease. One of them is Me, and I think I can't remember the other one. Do you all? There's
There's
a
a few
second one.
Remission, and there's a few others as well.
Yeah. So. Other questions? Well, great. If I can just.
Sorry, somebody is
go ahead.
asking a question, I think.
I apologize. I couldn't hear.
Okay, yeah, so I just wanted to bring up an example of how technology is, and specifically AI can drastically affect the health market. The personal example of a company, an AI company that I worked with that utilized AI in combination with genomic.
Could you repeat the question so that we can hear it?
Yeah, what's the question, Andrea? For some reason, they're not, is it green? Is it light green there?
Yes, but it's not mic'd.
Okay, can you hear
Much
me?
better.
Yes.
Yes,
Okay.
thank you.
Sorry, I just want to bring up an example of how technology, specifically AI, can drastically affect the women's health market. There's an example of a company that was funded by my group that utilized AI to look at the genomic clusters that cause endometrial cancer or endometriosis, sorry. And they identified 3 clusters that are the causal factors of that. And then those 3 clusters also were causal factors in 3 other women-led cancer types. So they completely reframed the entire disease state in 5 months, something that's never been discovered in the entire history of the disease. So
What's the question?
so just wanted to see if you guys had any experience relative to technology and how that's changing the framework of the industry itself.
I'd love to know the name of that company, by the way.
Yeah.
So is AI changing the paradigm for your investing as well?
I'm
Are
happy
you
to-
guys looking at AI or technology as it relates to women's health?
No, I think it's an important component of all the investments we're looking at. I don't think that I haven't seen an AI specific device that's FDA approved and go, as a target, because I think it's too early. But the labor and delivery device I mentioned has a data component where we actually can track the labor progression, and it could be predictive about whether or not a woman needs a C-section. So that's a science, that's a academic component, but unfortunately we're not funding that piece right now because we're funding it for FDA study. But I do think that down the road, hopefully we'll be able to fund more of those opportunities in women's health.
We do see AI as a component for many companies in our pipeline, and I think it's probably similar to other TAs as well. Like, there's the way that it can dramatically change basic research, like what you just described. We've seen it with drug discovery, with providing care, like kind of AI agents helping it kind of extend the care team, as well as AI that improves efficiency and productivity of health delivery. So I would say those are probably similar buckets as we see more broadly in healthcare. And I will call out that Lux Capital just wrote a great report, I believe actually this week, about AI in women's health, if you want to look that one up.
And I would just also add imaging. We're seeing that
Yeah.
in post imaging especially.
Any other comments here? Mitzi, this has been a fantastic panel, and I invite you to come back sometime in the year and do it again. So
I would
thanks
love
so much,
to.
folks.
Thank you. Thanks to all the panelists and to you.
Thank you for the opportunity.